Hello, and welcome back to the channel. It's Dr. Nell, and we're in our community public health safe space where meaningful conversations take place. Well, today we're back outside and we're going to have another conversation, but today we're switching it up a little bit and we're going to talk about public health concern as we look at our elderly and their retirement. So let's get going. Remember, like, comment, share, and subscribe. Talk to you soon. Let's keep it going. Yes, over the past several years, the world has experienced one of the most significant global health disruptions in modern history. Between 2019 and 2024, millions of people began thinking about healthcare in a very different way. For decades, many individuals delayed doctor visits, avoided preventative health, and relied mostly on home remedies and traditional medicine. Healthcare was often something people only thought about when something went wrong, and we know that. But the events of the early 2020s changed that. People started asking deeper questions like, do I really understand my health? What happens if I suddenly need medical care? And perhaps the biggest question for many Americans thinking about retirement is this: if I retire somewhere else in the world, will healthcare be there when I need it? This is a very important question. Today, more Americans than ever are considering retiring abroad. But the conversation about retirement is changing. It's no longer just about beaches, climates, or a lower cost of living. No. Now, the bigger question is healthcare. And of course, it's a very important question. Because living in paradise only works if you can receive medical care when you need it most. Today we're going to explore how global health events changed how people view preventative health, why healthcare access is now shaping retirement decisions, the 4 Caribbean countries with some of the strongest healthcare systems for retirees, and 3 European alternatives that many Americans are starting to consider. Because retirement should bring peace of mind, not uncertainty about healthcare. So the topic is retiring abroad. Is Caribbean healthcare enough, or are there European alternatives? Now we want to take a look at how global health events change preventative health awareness. Before 2019, preventative health care often wasn't a major priority for many people. Annual checkups were skipped, health screenings were delayed, and some individuals relied almost entirely on traditional remedies instead of modern healthcare systems. But the global health crisis that unfolded between 2019 and 2024 forced people to rethink prevention. Suddenly, people were talking about things that were rarely discussed outside the medical setting. We had things to discuss like immune health systems, and a lot of people were concerned, yes, about their immunity and their immunity health. Chronic disease risks, infection prevention, and early detection of illness were some of the topics that were discussed widely. For many individuals, this was the first time they truly realized something important. Healthcare is not just about treatment, it's about preparation. Preventative health became part of everyday conversations. People began researching medical topics online. They started looking for primary care providers, and many began taking preventative health more seriously. But the shift didn't just change personal health habits. Oh no. It also changed how people thought about where and how they lived. It also changed how people had conversations with each other about healthcare. Now, retirement abroad is growing, but healthcare also matters. Every year, thousands of Americans choose to retire outside of the United States. The reasons are easy to understand, of course. There are lower cost of living, warmer climates, slower lifestyles. In many cases, retirees discover their retirement income stretch much further than if they were here in the United States. But retiring overseas also raised very important questions for many individuals who were thinking about retirement and moving. What happens if you need health care was one of the major questions that were asked. One fact many people don't realize is that Medicare generally does not cover health care overseas or outside of the United States. This means retirees must rely on local healthcare systems or private international insurance. And healthcare quality can vary significantly from one country to another. Some countries have modern hospitals and well-trained specialists. Others may have limited healthcare infrastructure or require patients to travel elsewhere for advanced treatment. So retirees are asking new questions. Not just where is the cheapest place to live, but where can I live safely and still have access to healthcare when I need it? Healthcare systems across the Caribbean have also been evolving. For many years, several Caribbean countries relied on medical partnerships with Cuba. Doctors and nurses from Cuba worked throughout the region, helping to support local healthcare systems. However, some of those long-standing medical agreements have recently ended or been restructured. For example, Jamaica has experienced changes in its medical workforce arrangements involving Cuban healthcare workers, and this will have an impact on healthcare going forward. These shifts mean some are now adjusting to how they recruit and maintain their healthcare workforce. When evaluating a retirement destination, it's important to consider not just hospitals, but also the stability of the healthcare workforce. Because a beautiful destination does not automatically mean a strong healthcare system. Now, we'll take a look at 4 of the best Caribbean countries for healthcare as we consider retirement overseas. For those who still want the Caribbean lifestyle, several countries stand out for their healthcare systems. Barbados. Barbados is widely considered to have one of the strongest healthcare systems in the Caribbean. The island offers both public and private healthcare services and has modern hospital facilities. Barbados is also politically stable and English-speaking, which makes healthcare communication easier for retirees. Bahamas. The Bahamas as one of the largest hospital systems in the region. Because of its close proximity to the United States, many retirees feel comfortable living there while still having the option to travel quickly for specialized medical care if needed. And I'm sure many of you have thought about these 2 countries. The next on our list is Antigua and Barbuda, which has a relatively strong ratio of healthcare professionals compared with its population. The country has invested in expanding healthcare services and continues developing its medical infrastructure. St. Kitts and Nevis, last but not least, offers a growing healthcare network with both public and private clinics, just like Barbados. Its smaller population, however, allows for relatively accessible healthcare services, although specialized care may still require travel abroad. Isn't it a beautiful day? Now let's look at the reality of island healthcare. There is an important reality retirees should understand about island healthcare. Even in countries with strong healthcare systems, certain specialized treatments may not be available locally. Major surgeries, complex cancer treatments, advanced neurological procedures. These types of care may require travel to larger medical centers outside of the island. Because of this, many retirees living in the Caribbean maintain international health insurance or medical evacuation coverage, which is something to think about. These types of care may require travel outside of the country, of course. Because of this, when maintaining evacuation coverage, healthcare across the Caribbean continues improving every year because they realize that they are getting more retirees who are seeking these kind of coverage, and the cost to move, it's easier to expand the infrastructure and improve these hospitals and clinics locally. But planning ahead is also essential because, as I said, the process is not fully complete, so we all have to plan ahead. Now, there are European alternatives many retirees are considering, and we are going to take a look at a couple of those alternatives. Because of healthcare concerns, some retirees are exploring European destination instead of the Caribbean. Portugal is one such destination, has become one of the most popular retirement destinations for Americans. The country offers a respected public health system, affordable private care, and residency programs that welcome retirees. Spain is our second, and Spain consistently ranks among the top countries with the best healthcare systems in the world. Its universal healthcare system provides high-quality medical care at relatively low cost, which is something many retirees enjoy hearing. Many retirees choose coastal areas such as Valencia and Alicante. Then, finally, there is Slovenia. This is one of Europe's lesser-known retirement options. The country offers modern hospitals, strong healthcare infrastructure, and a high quality of life. For retirees looking for European healthcare standards without extremely high living costs, Slovenia is becoming increasingly attractive. So see, there are options, and we have retirees who are seriously considering their European options. Such a lovely day. Now let's continue. The global health crisis between 2019 and 2024 changed how people thought about healthcare and still thinks about healthcare. It increased awareness of prevention, early care, and the importance of reliable healthcare access. But it also changed how people think about retirement. Moving abroad is no longer just about beautiful scenery or lower costs. No. It's about health security. Before choosing where to retire, people now ask questions like, are hospitals accessible? Are specialists available? Is the healthcare workforce stable? And if something serious happens, will the healthcare system be able to respond? These are very important questions. Because retirement should be about enjoying your life, not wondering if you can maintain and sustain health. It's not about worrying about whether healthcare is there when you need it. So, As we continue our public health advocacy, we want to ensure that we're not just thinking about one set issue or one set of people. We want to span across the lifespan, and our elderly are very important. We want them to be comfortable because, as I always say, we are all aging and we're all going to need these same infrastructure, whether they are lacking or not. So at this point, when certain services are lacking, we want to ensure that we advocate for change and improvement in our healthcare system. So as I always tell you at the end of every video, take a deep breath, open your eyes, because the information has been shared, your perspective is growing, your knowledge is growing. And as always, I'm here to advocate and ensure that you are knowledgeable. Please leave your comments in the comments section. Remember to like, subscribe, and share the video. And I'll talk to you soon. Have a wonderful day. Isn't it beautiful outside? Get outside, take a breath, take a walk, and I'll talk to you again.